On a sunny May morning in the year 1995 in San Francisco, my guest is Dr. Harry S. Jonas. Harry, thank you for being with us.
Thank you.
Dr. Jonas is currently Assistant Vice President for Medical Education at the American Medical Association, and certainly among the highlights of his long and distinguished career in education in obstetrics and gynecology was his service as President of ACOG in the years 1986-87. Harry, tell us where your career began.
Well, I suppose you'd say it began when I was in high school sometime, although my parents say that I was one of these kids who used to say I wanted to be a doctor from the time I was 6. But I remember in high school receiving the Bosch and Loam Science Award, and that seemed to be something that inspired me to want to go on into medicine or science.
Where were you in high school and what geography?
I was raised in a small town in northeast Missouri, Kirksville, Missouri. Went to high school there, graduated from high school there. My wife was in my high school class.
And medical school where?
And then the war intervened. I joined the Navy when I was 17, but knowing that I was going to get drafted if I didn't join the Navy, which was supposedly better than the Army, so that's why you enlisted, I got a year of college chemistry in before I graduated from high school, and then I took a summer of college physics at Washington University in St. Louis before I went to service. Then I came back from service in 1946 and entered Washington University, where I completed my undergraduate work and started medical school in 1949. Graduated in 52.
That was an accelerated program?
No, it wasn't. I actually started in 48, but I got my bachelor's degree in 49, so medical degree in 52. And then I stayed on in St. Louis at Barnes and St. Luke's hospitals and took my residency. OB-GYN. Willard Allen was the chairman of OB-GYN at Washington University at the time.
What led you into obstetrics and gynecology? Was it Dr. Allen, or were there other things?
Well, Willard Allen was a wonderful inspiration. His work on the isolation of progesterone was a great inspiration to me. But I think one of the things, students have very illogical methods of choosing careers sometimes. And when I took my OB clerkship at St. Louis Maternity Hospital, they were short of house staff, and so they gave medical students a lot of responsibility, and I felt, like a real doctor, even though I was a medical student. And it was a busy place. We had a wonderful house staff and a wonderful attending staff, and I learned a great deal about obstetrics, and I really enjoyed it. And then when I took an elective in my senior year on OB at St. Louis Maternity, I was really a sub-intern and intern and had more responsibility, and at that point I was hooked, so to speak.
When did you complete your residency then?
I completed my residency in 1956.
And obviously practiced after that?
Oh yes, I would say that I was torn near the end of my residency, like many young people are these days, and in my era as well. Whether you want to go into private practice or stay in the ivory tower in the academic environment. I loved the academic environment of St. Louis, and St. Louis at that time, as you know, was kind of a hotbed of famous people in our specialty. So I was really torn, but I had 2 children at the time, and in those years there was a big economic differential between what an academic physician made and what a practicing physician made, and I suppose I was somewhat influenced by the fact that I felt I had to support my family, and I moved to Independence, Missouri, and joined another practitioner, Dr. Wallace Stacy, who trained also at St. Louis under Dr. Allen.
You were in Independence a good long time, weren't you?
I was in Independence for 19 years, actually, and but when I first started in practice, I had gone to see Dr. Harold Gainey, who was in Kansas City, and Dr. Gainey was in charge of the residency program at the General Hospital, which in those days we didn't have a medical school, and all the teaching and residence was done by volunteer community physicians. And so I started right off the bat in the mid-50s being involved in teaching residents at the Kansas City General Hospital. And then years later, when the new medical school came about and I'd been involved in helping make that happen, I left private practice, went full-time with the new medical school, University of Missouri, Kansas City. Was the first full-time chairman of OBGYN.
With the legendary Dr. Gray Diamond.
With the legendary Gray Diamond, the cardiologist who helped start the school.
When was that? When did the school open?
The school opened actually in 1972. It took its first students. I came on in 1974.
And were department chairman
I was department chairman until 1978. In 1978, I became dean of the medical school and served as dean until 1987, almost 10 years.
Harry, your involvement with the college has certainly been important in your career, too. Where did that begin?
Well, I think I really started back in the early days of my practice. I was active in our local Kansas City Gynae Society, and I also became a member of the Central Association and was involved in that wonderful organization as well. But I started out interested in the college, began going to college meetings. I attended that first meeting in Cincinnati, and probably everyone since, or nearly everyone since. And then I went through the officer ranks of at the section level. I was Missouri section vice chairman and then chairman. And I think before that I was secretary treasurer. Then I went into the district activities and was secretary treasurer of District 7. And then ultimately chairman of the district, which is when I went on the board.
And followed that up by ultimately a term as president of the college.
Yes, I chaired the Healthcare Commission, which was one of my greatest enjoyments in the college. And one of the people that was one of my role models in the college was Irv Nichols. And Nick encouraged me and gave me lots of encouragement to stay actively involved in the college. And I did that. And the Healthcare Commission, which was then staffed by Nick, was pleasurable experiences in the college.
In the time that you were president, what were some of the key issues that you faced and the decisions you think were most important in that time?
Well, first of all, I would say that the one issue that was consuming not only my presidency, but the ones immediately before and immediately after was professional liability. It was the time that you had taken the initiative to start a new office of Department of Professional Liability, and certainly that issue consumed a good deal of my presidential year. There was no place you could go around the country without trying to respond to the anxiety, the concerns, the hostility of the fellows about why we couldn't solve that problem. Even though I think they came to realize as we explained to them all the things that the college was doing to try to address that problem. Here we are, a decade later, and the problem still isn't totally solved, although depending on the states, there's still a big differential in how the problem is for individual obstetricians. The other thing is I followed by a couple of steps Teddy Klein, the first woman to be president of college. And Teddy Klein's theme of prevention of unintended pregnancy was a natural theme that I was equally interested in, having been very much concerned about the problem of unintended pregnancy and very much concerned about the problem of abortion. The first patient I ever saw as an intern in a medical service at Barnes Hospital was a woman who had 12 children and had self-aborted herself, perforated the vagina, came in with her intestine hanging out, and had massive infection and ultimately died. And I was so stricken by that experience that this whole area of unwanted, unintended pregnancy and abortion really consumed me. I became active in Planned Parenthood. In fact, I even moonlighted as a resident in a Planned Parenthood clinic in St. Louis, and really felt the importance of the family planning issue. And I looked at a theme that I might adopt after Teddy's theme on unintended pregnancy and thought that maybe I ought to deal with the subject of abortion, a very controversial, very divisive subject, and everybody advised me not to do that, not to pick a theme that was that controversial, but I did.
And let it well.
Well, my presidential address was entitled "A Time for Reason," and I tried to stress the theme that the best way to prevent abortion is to prevent the need for abortion, and do so with education and with family planning. I tried to carry that theme. I think that the address was well received. The theme was clear, but how much progress we've made on quieting down the debate over abortion is still, it's not any quieter.
Reason does not always apply to these issues. That's right. Since the time you were president, or I guess actually preceding that, you went with working with the American Medical Association in a very key role. Would you tell us something about that?
Well, I had to ask myself when I finished my dean's tenure, what do I do now? Do I try to hang around the old school that I helped start and look over the shoulders of
criticize those who followed you?
Right, or do I look for a new professional opportunity? And the opportunity opened up with the agency known as the LCME, the Liaison Committee on Medical Education, which is the agency that accredits U.S. and Canadian medical schools. And so my areas of responsibility at the AMA are medical education, mostly undergraduate, and I've kept an active involvement. I have a faculty appointment in Northwestern in the department. Dr. Shara is my chairman. And I teach medical students. I give oral exams at the end of clerkships to medical students. And most recently I've been involved in teaching in a sequential 4-year course on ethics and a new course that I'm helping to work with, which I'm very interested in, namely on communication skills. How can we teach doctors to be better communicators with their patients?
Well, actually, with the LCME, that's the group that accredits medical schools, is it not?
That's correct. That's correct. We're the recognized federal agency to accredit the 125 U.S. and 16 Canadian schools.
Well, I didn't realize you accredit the Canadian schools as well.
We do. The Canadians have their own accrediting system, but they also want LCME accreditation, so we participate in their process as well.
That is, as I understand it, a very time-consuming enterprise.
It is. It involves a lot of travel. I go around the country and see a lot of medical schools. You, having been a dean of a medical school, you're pretty familiar with medical schools. But the beautiful thing about American medical education is the diversity of our medical schools. The University of North Dakota is a little bit different from Stanford and Hopkins, and they have different missions. They have different sizes, and it's great to go around the country because I still think we have the best medical education system in the world, and we're trying to make it better, of course, and adapt to the changing environment. And there's a lot of dialogue nowadays about proper teaching in certain areas, and women's health is certainly one of those key areas, which is a responsibility for the college, and therefore I hope that the liaison between what I do and what the college does can continue.
There's another important role that you had with the college that I think we haven't mentioned up to this point, and that during the time that you were president and before, in terms of the long-range planning, you worked on our acquisition of a new headquarters building in Washington. Could you say a word or two about that?
Well, I did that. I think you deserve a great deal of credit for having the vision to outline a plan that we as the planning committee kind of picked up on and ran with for you and for the college. And we had the benefit of some good staff people and Phyllis Dalbert and others who were fantastic in their helping us put that together. But I think that was a big accomplishment during my time, and particularly the very ingenious way we sent out requests for contributions for the new building, which were voluntary, but
primarily non-voluntary.
But almost non-voluntary, but were successful. The other things I did with the college were by involvement with the junior fellows. I was the junior fellow advisor. I was very active with the junior fellows from the earliest years, and I really think that program is one of the greatest things the college has done. I was also on the board of NACOG and served closely with that organization.
The move to the new building, I think, was a highlight. I remember as well when you were involved in long-range planning with the college that you emphasized that perhaps one of our greatest future strengths was going to be to do the things we did best, that is market education and do things of that nature.
I think the college has just been outstanding in its ability to fulfill its educational mission. I don't know of any specialty organization that does a better job for its fellows and for the public than we do.
You won't be surprised that I agree with you.
I won't be. And, I want to give you credit, too, for the wonderful work you did as our chief executive and the wonderful staff that you picked. People like Shirley Shelton and Elaine Locke and those people who've served the college as faithfully and as wonderfully as you have.
Harry, it's been a long and distinguished career. Are there any other favorite issues you'd like to pick up on as we close?
Well, one of the issues that I'm a little disappointed that we haven't moved as fast on is the issue of getting more women into positions of leadership in the college. When I had gavelled my first meeting to order as president, I looked around the room and noticed, because Teddy Klein had gone off the board, there were no women on the board. And I have tried hard to enunciate that as an issue that I think the college should pay more attention to, because the demographics of women's health care physicians is changing with so many more women, and I think we have to see that women are in leadership positions in this organization.
Absolutely, and I hope your best wishes come true.
Thank you. Thank you very much.